Hello everyone, welcome to RAAONLINE. I'm Dr. Abhinaya. I'm a consultant pediatrician. So in Nelson-based pediatric teaching, in the chapter discussion of neurology, the next topic will be pseudotumor cerebri. So pseudotumor cerebri syndrome or idiopathic intracranial hypertension is going to be the topic of discussion now. So this PDCS is an umbrella term for a series of symptoms and signs. The underlying condition is increased intracranial pressure. So why here we call it as a pseudotumor cerebri? Because here the brain parenchyma is normal, there is no space occupying lesion and there is no ventriculomegaly, malignancy or any infection. Okay. So the increased intracranial pressure is present in the absence of infection, malignancy, space occupying lesion. The brain parenchyma is normal. When you can identify a cause, then it is called as a secondary pseudotumor cerebri syndrome. Previously, we were referring it to as a benign intracranial hypertension, but now either idiopathic intracranial hypertension or pseudotumor cerebri is well regarded. So benign intracranial hypertension is no more used. Why this was why we stopped using benign intracranial hypertension is the term benign. This is not benign because when there is an increased intracranial pressure, this has a potential for vision loss and there is a reduced quality of life because of the significant headaches that these patients undergo. So it is no longer benign. So that's why this term BIH, benign intracranial hypertension, was rejected. So coming to the epidemiology, it's quite rare, 0.6 to 0.7 per 1 lakh children. We have the diagnostic criteria which was revised by Friedman et al., which is the criteria for pseudotumor cerebri syndrome. So usually or very commonly, a typical patient of a pseudotumor cerebri syndrome is an adult female who is obese. But it is not very common, we know that. It is not very common in pediatric age group. In children, boys and girls are equally affected. And in children, we know that obesity or overweight is not going to influence the development of primary pseudotumor cerebri unlike the adult age group where obesity is an important risk factors. Okay. So, what are the risk factors in pre-pubertal age group? So, sorry, this is all again the post-pubertal. So, post-pubertal is obesity, weight gain, PCOD, females and family history. Okay, so these are all post-pubertal. So, some conditions which are associated with pseudotumor cerebri syndrome, most of which are the causes for children. So, we divide that into endocrine, metabolic conditions, autoimmune conditions and systemic conditions. In endocrine conditions like where there is deficiency of the steroids. So, hypoparathyroidism and Addison's disease are associated with secondary PTCS, and when you give from outside, that is exogenous administration of these endocrine hormones. Okay, so either you give a growth hormone, thyroxine administration, steroid administration, leuprolin injections, withdrawal of chronic steroids. So either you administer it or you withdraw the chronic steroids. This can be associated with pseudotumor cerebri syndrome. Hypervitaminosis A. Inadvertent use of vitamin A suspension can also cause pseudotumor cerebri. Anemias, leukemias, renal failures and autoimmune conditions like SLE, Behçet's are all associated with secondary PTCS. So coming to the central nervous system abnormalities. So predominantly it is venous abnormalities like CSVT, superior vena cava syndrome and some conditions like hypercoagulable state which causes the CSVT, middle ear infections. All these can cause secondary